All right, well, good morning, everyone. Thanks for coming. My name is Nathan Bryan, and I'll spend the next hour teaching you about nitric oxide and kind of our 20 years of research and discovery of how we've been able to make a solid dose form of nitric oxide gas. So I've been in academic medicine for the past 25 years, really trying to answer four fundamental questions. And how does the human body produce nitric oxide? What goes wrong in people that can't make it? What are the clinical consequences? And then how do you fix or restore nitric oxide production? So I have several dozen issued U.S. international patents, published over 100 peer-reviewed papers. I've given over 300 lectures around the world. These are my conflicts of interest. We've commercialized a lot of the discoveries we've made out of the University of Texas Health Science Center in Houston, and I'm going to share with you those discoveries this morning. So I've always seen it as my job is to give physicians the tools they need to treat, cure, and prevent chronic disease, and that requires us to think differently, to see what everyone else has seen, but to think what no one else has thought. And in these 25 years, I've come to the realization that chronic disease, doesn't matter if it's Alzheimer's, diabetes, cardiovascular disease, it's only caused by two things. The body's missing something that it needs, or it's exposed to something that it doesn't need. But the end result of that is decreased nitric oxide production, decreased circulation, inflammation, oxidative stress, and immune dysfunction. And those are the hallmarks of every chronic disease. So let's start by looking internally at the human body. So there's a non-invasive imaging modality called a SPECT scan. And a SPECT scan is really telling us how well perfused an organ is. Yep. So this just describes what SPECT scans are. They're basically looking at how well perfused a particular organ is. And in this case, it's the brain. So what you're looking for and what you hope to see is a nicely contoured SPECT image. So that tells us that all parts of the brain are being perfused. There's oxygen, nutrient delivery. In this patient here, this is a former NFL player with chronic traumatic encephalopathy. And you can see these holes in the brain are reflective of what we call focal ischemia, or areas in the brain where there's no blood supply. So it's the lack of oxygen and nutrients to this part of the brain that's responsible for neurological disease. And obviously, this is a heart and angiogram. And you can see here, this patient had an embolus or thrombus in the left circumflex. You go to the cath lab, you aspirate that, you can restore blood flow. If you do this in a timely manner, you can completely restore cardiac function. So the idea is you have to perfuse all organs and tissues. If you look a little bit deeper, and these are either sensory or motor neurons, these nerve fibers have to be well supplied with good blood vessels so you can get oxygen and nutrients and sodium and potassium to elicit an action potential. When you develop vascular disease, these neurons no longer get perfused and you develop neuropathy. So the whole point of me showing you this is that to convince you every single chronic disease is characterized by decreased blood flow. If you can restore blood flow and perfusion to these organs, you can actually overcome the dysfunction. So how do we do this? That's the role of nitric oxide. So it's a very simple molecule. It's a gas when it's produced inside the body, and then it's gone in less than a second. So it's produced, it activates some signaling pathways, and then it's gone. And this was a famous quote by Val Fuster in 1998 when the Nobel Prize was awarded, that the discovery of nitric oxide and its function is one of the most important in the history of cardiovascular medicine. In this study here, I show this because prior to this study, it was thought that nitric oxide is a vasodilator, meaning that when it's produced, it opens up blood vessels. But this study revealed that it's much more than that. It's responsible for tissue oxygenation. So the cardiopulmonary cycle is really a three-gas system. We breathe in oxygen. We deliver oxygen. It binds to hemoglobin when it goes from the arteries to the vein. Oxygen comes off. It picks up carbon dioxide. We excrete it in the exhaled breath. But this doesn't occur unless nitric oxide is bound to hemoglobin. And we witnessed this during COVID over the past 3 years because patients would lose blood oxygen saturation. It put them on 100% oxygen or even mechanically ventilate them, and yet their blood oxygen wouldn't improve. So in our nitric oxide drug study, we could improve blood oxygen saturation from 76 to 98 within 8 minutes, just by breathing room air and restoring nitric oxide. And it's involved in every biological function, from maintaining the gut motility in the periphery. I'm going to share with you it's the molecule that's responsible for our own stem cells to mobilize and differentiate. It's a neurotransmitter in the central nervous system. It's the molecule responsible for erections in both men and women. And it's how our immune system fights off invading pathogens, kills viruses, bacteria, and any foreign pathogen. And in 1998, the Nobel Prize was awarded for the discovery of nitric oxide by Fred Murad, Lou Ignarro, and Bob Furchgott. And so it was Fred who recruited me to join the faculty at UT Medical School in Houston back in 2005. So a lot of the work we did was at the Institute of Molecular Medicine in the drug discovery program. So let's start out by looking at kind of some objective measures of aging and longevity. So there's three main kind of hypotheses in terms of aging and chronic disease. There's telomere shortening, shorter telomere, shorter lifespan, mitochondrial dysfunction, meaning that in chronic disease you have less mitochondria generating less energy, less efficiently, and then loss of stem cell function and repair. But nitric oxide is what controls all of those. Nitric oxide controls telomerase activity, mitochondrial biogenesis, and function. So now we have this unified theory of aging that if you restore nitric oxide, everything else works as intended. And these are the data showing you that obviously shorter telomeres. Telomeres are the ends of the chromosomes, that with each cell division, they can get shorter without an active, if the telomerase enzyme isn't active. And then this here is said that shorter telomeres, shorter lifespan. And these are the data that told us that nitric oxide actually controls that. So nitric oxide is the master signaling molecule in the regulation of the enzyme that prevents telomere shortening. And it provides an opportunity for innovative therapeutic approaches based on the use of nitric oxide active compounds. And this is getting a little bit technical, but I just want to reveal to you that without nitric oxide, you don't even get genetic expression or translation of the telomerase enzyme, because this promoter here is dependent upon eNOS production of nitric oxide that allows the cell to actually translate and transcribe the telomerase enzyme. So without nitric oxide, you don't get telomerase, you get shorter telomere, shorter lifespan. Mitochondria, obviously those are the energy-producing organelles of the cell. Every major chronic disease is characterized by decreased numbers of mitochondria in each cell, and the mitochondria aren't functional. And it's nitric oxide that controls all aspects of the metabolism of the mitochondria. There are known modalities that induce mitochondrial biogenesis, things like caloric restriction, intermittent fasting, sirtuins, NAD. All of those are known to induce mitochondrial biogenesis. But this pathway is dependent upon the cell's ability to make nitric oxide. Then that induces PGC1 alpha, and you get mitochondrial biogenesis. So without nitric oxide being produced in the cell, intermittent fasting, caloric restriction, all these modalities that are suggested to improve mitochondrial biogenesis can't. We have to first restore the production of nitric oxide. And if you look at exercise performance, nitric oxide actually allows oxygen to diffuse further into tissue. So now if you're a well-trained athlete, you want to improve your nitric oxide production, now you can actually improve the performance, lead to decreased lactic acid buildup, improve recovery. And mechanistically, we know this occurs at both complex 1 and complex 4 of the mitochondrial electron transport chain. And then stem cells. We're constantly wearing ourselves out. We just have to repair and replace dysfunctional tissues. And that's the job of our resident stem cells. And it's nitric oxide that actually tells our own stem cells to mobilize and differentiate. And then at Texas Heart Institute, we actually published a study showing that the bioavailability of nitric oxide can predict stem cell therapy success or failure. So if you're doing stem cell or regenerative medicine, you've got to fix the nitric oxide production in these patients before you deploy stem cells. And then this is a paper we published with Dr. Murad showing that we could take embryonic stem cells, promote them, or actually give nitric oxide at a certain stage of differentiation and turn them into cardiac myocytes, beating cardiac myocytes. So if we get to the root cause of the number one killer of men and women worldwide, which is cardiovascular disease, this old quote from 400 years ago still holds true today. So if you look at the inside of the blood vessel, the older we get, in some cases you start to get plaque deposition. Over time, this plaque becomes unstable, it ruptures, and that's heart attack or stroke. So about 20 years ago, we started asking, well, what happens to nitric oxide in this? So as long as these endothelial cells can make nitric oxide, it prevents this plaque deposition, plaque instability, and plaque rupture. So as long as you can maintain some level of nitric oxide, it prevents plaque deposition and prevents cardiovascular disease. And what causes cardiovascular disease? There's 3 finite responses to the infinite number of insults we give our body. The body always responds with inflammation, immune dysfunction, and oxidative stress. And I'm going to show you the data where we've actually demonstrated that we can shut this down through the production of nitric oxide. So let's take them one by one. There's 3 sources of oxidative stress in a cell. There's superoxide being produced from NADPH oxidase. Nitric oxide suppresses this enzyme, so shuts down superoxide production. If we have an uncoupled electron transport chain in our mitochondria, this leads to superoxide production. nitrite and nitric oxide basically recouple this. And then the enzyme that actually produces nitric oxide can produce superoxide. And we published this in 2009 that we can actually recouple the NOS enzyme, improve nitric oxide production, and completely eliminate oxidative stress. So the fundamental question then became, how do we control and regulate nitric oxide production? And I'm going to go into a little bit of detail just so you have a pretty good understanding of this. But there's two ways the human body makes nitric oxide. One is through this enzyme nitric oxide synthase. The other is through diet. And this explains the mechanism of a Japanese diet, plant-based diet, and even vegetarian diet, that the body can convert nitrate found in green leafy vegetables into nitric oxide. But when both of these systems fail, then you become nitric oxide deficient. So let's assume this would be a healthy individual. So this would be the cross-section of a blood vessel. This is the inside of a blood vessel, and this is the smooth muscle that surrounds all blood vessels. So when we start to exercise, that causes shear stress that tells this enzyme to make nitric oxide. Nitric oxide then diffuses into the smooth muscle, activates an enzyme called guanylyl cyclase. This enzyme converts GTP into cyclic GMP, and that's responsible for smooth muscle relaxation. And this is the mechanism of action for drugs like Viagra. So nitric oxide turns the switch on, Viagra keeps it on. That's why you're warned against 4-hour erections and unsafe drop in blood pressure. But 50% of the men that are prescribed Viagra don't respond with better erections. And the reason for that is in these non-responders, they're not able to make enough nitric oxide here to prime this pump and actually lead to an accumulation of cyclic GMP. So we've demonstrated now that if we can restore nitric oxide production, we can turn non-responders into responders and actually potentiate the effects of drugs like Viagra. But unfortunately, it's this pathway that becomes dysfunctional with age. So the older we get, the less nitric oxide we make through that enzyme. And so by the time we're 40 years old, we only have about 50% of the nitric oxide we had when we were younger. And this is the age people start to feel the effects of aging. And just to show you the importance of this, your ability to produce nitric oxide predicts your exercise capacity. In fact, it's predictive for all types of performance, whether it's sexual performance, cognitive performance, or even athletic performance. So this is a study. If you take well-trained athletes, you put them on a treadmill, their body produces nitric oxide. If you do that with older individuals with known cardiovascular risk factors, they fail to improve nitric oxide production, and they fail an exercise stress test. So when you can't make nitric oxide in the coronary arteries, that's diagnostic for coronary artery disease. And then there are a lot of companies out there and products using L-arginine to give arginine to produce nitric oxide. But this enzyme needs 8 different cofactors and substrates to make nitric oxide. And L-arginine is never the limiting factor. And in fact, if you give arginine to patients that had a heart attack, you actually cause more damage. So in this clinical trial, they actually stopped the study halfway through because the patients that were getting L-arginine actually had about a 50% higher mortality. So arginine can cause death in patients that have previously had a heart attack. And the same thing happens with patients with peripheral artery disease. You give arginine to patients with PAD, they get worse. This told us that really we have to understand the enzymology and biochemistry of nitric oxide, and L-arginine is certainly not the solution. So I'm going to take you back 20 years because we were asking a very fundamental question 20 years ago. If we improve nitric oxide production in the heart, can we protect from injury from heart attack? And then if so, could we trace this phenotype biochemically to give us some prognostic or diagnostic biomarker? And in this study, we took mice and we transfected these mice with the nitric oxide synthase enzyme. So we overexpress this enzyme only in the heart. And then we give these mice a heart attack. We do open heart surgery. We tie off the LAD with a suture for 1 hour, and then we reperfuse for 24 hours and look at the amount of injury. And these mice don't see any injury. So then we started looking at other tissue and realized, well, their plasma levels of nitrite and nitrate were elevated. We harvested the liver of these mice. And so understand that nitric oxide produced in the heart, it's gone in less than a second, so it can't survive transit to the liver. But something was eliciting this transport mechanism and modifying these liver enzymes, or modifying the liver and increasing nitric oxide production. So then the question was, what does this mean, if anything? So then we shut off blood supply to the liver for 1 hour, reperfused for 5 hours, and then measured the liver enzymes, which are markers of injury or damage. So now we found that nitric oxide produced in the heart protected the liver from injury. And we published this in 2008, showing for the first time that nitric oxide was a hormone. and that nitric oxide produced in one biological compartment would actually elicit cytoprotection to the heart, the brain, the liver, systemically. So this was my eureka moment in science, because this told me all I had to do was generate nitric oxide gas in a single biological compartment. And understanding the oral cavity is a way we can generate nitric oxide. And that was the genesis of my orally disintegrating tablet that generates nitric oxide gas, and we have systemic effects that lead to cytoprotection. The next question was, could we use diet as a way to intervene and protect the heart from heart attack, from injury from heart attack? And in this study, we basically took mice and we put them on a Western diet, the standard American diet, which is really inflammatory diet. And then we basically just gave it back in the drinking water what we took away. So you can see here, we could modulate their plasma and cardiac levels of these nitric oxide metabolites. Again, we subject these mice to a heart attack. The mice on the standard American diet had about a 20% mortality. Then they had about 50% greater infarct in the heart. So 50% greater injury from heart attack simply by being on a Western diet. And if we gave it back in the drinking water, 100% survived up to 24 hours. We had about 60% less infarct. And after this, if we do echo of the hearts in the animals, the heart beats just like it never saw an injury. The next experiment, we took eNOS deficient mice. So these are mice that can't make nitric oxide through the enzyme. We put them on a Western diet to basically completely deplete their body of nitric oxide. And then we give them a heart attack and we add it back in the drinking water. And you can see here, these mice do very poorly. So this is the white area is dead tissue in the heart. So these mice don't even survive up to 24 hours. But if we add it back in the drinking water, we can actually protect the heart from injury and 100% survive up to 24 hours. So now if we just give this in the form of a supplement or supplement what's missing in the diet, we can protect the heart from injury. We did this in the brain. You can do it in the liver. It's systemic. Now, what about diabetes? We have a global pandemic of diabetes. And we've known for 30 years that once you get diabetes, it shuts down nitric oxide production. And that's the reason you develop, diabetic retinopathy, diabetic neuropathy, increased blood pressure, cardiovascular disease. When we knocked out the eNOS enzyme in mice, they developed type 2 diabetes. So lack of nitric oxide production causes insulin-resistant type 2 diabetes. So this suggested to us that if you have a decreased production of nitric oxide, that leads to insulin resistance. If not corrected, leads to diabetes. Once you develop diabetes, it further suppresses nitric oxide production. And that's why these patients are so poorly managed, because nobody's thought about including nitric oxide as a potential therapy. And we discovered in 2014, when we published this paper, that nitric oxide is necessary and sufficient for glucose uptake. So for those of you, just to get you a sense of insulin signaling, insulin is secreted from the pancreas. It binds to an insulin receptor. And when it binds, it starts these intracellular signaling cascades, activates AMP kinase, which is the mechanism of action for glucophage or metformin. But both of these converge on the eNOS enzyme. So these insulin is supposed to turn on the enzyme that makes nitric oxide. But in diabetics, this enzyme doesn't work. So then GLUT4 never gets the signal. So that was kind of the gap in the literature at the time. And here we engineered some cells and we tagged GLUT4 to green fluorescent protein, so we could actually see this protein move in real time. And you can see when we activate it with an NO donor or just sodium nitrite, you can see GLUT4 start to go to the membrane. So when it's not activated, it's a silosylic protein, so it's inside the cell. When we activate it, it goes to the membrane and improves glucose uptake. And this was our mechanism. We have 2 cysteine residues on GLUT4 that when modified by nitric oxide or NO compounds, that tells the GLUT4 to go to the membrane, bind glucose. You completely overcome the metabolic defects of type 2 insulin-resistant diabetes. You can even do this in type 1 diabetes and improve glucose uptake. What about inflammation? We all know that inflammation is the silent killer. And mechanistically, inflammation is when the blood vessels become sticky like Velcro. All cells stick to them. Platelets, monocytes, neutrophils, and then when they stick, they migrate through, and then they start getting these foam cells, immune dysfunction, oxidative stress. But it's also appreciated that if you can prevent these monocytes and neutrophils from sticking to the lining of the blood vessel, activating platelets, then you can prevent cardiovascular disease and inflammation. And so here we've got real-time intravital microscopy. So this is a single blood vessel on a standard American diet, an atherogenic diet. So you can see here, there's a lot of blood cells that are stuck to the lining of the blood vessel. There's a little bit of blood flow getting through here, but this is a heightened state of inflammation. So this happens after you go and eat McDonald's, Big Mac and fries. If we take that same atherogenic diet, but we give our nitric oxide, you can see here the blood vessel is more dilated. These immune cells home along the endothelium, but they don't stick and they don't migrate through. So this is even after an inflammatory diet. So this doesn't give you an excuse to go eat a bad diet. If you do, you better make sure your nitric oxide production is working. And then about that time, we were publishing a lot of papers, 10 or 12 papers a year, and I was contacted by a cardiologist that was trained in China. And his question was, do the traditional Chinese medicines they've used for thousands of years in China work perhaps through a nitric oxide dependent pathway? And so Yaping came and spent 4 years in the lab, and I sent him to a local acupuncture shop, and I said, bring me back some herbs or tinctures that you would use to treat a patient with coronary artery disease, high blood pressure, heart failure, and let's see if we can detect any nitric oxide coming off of these herbal extracts. So in this particular study here, this is a nitric oxide analyzer. So this detects nitric oxide gas. So you can see we start with a couple of these extracts, nothing happens, pretty anticlimactic. Then we wash it out, we put another one in, we get a little bit of nitric oxide here. We wash it out, we put another one, we get a spike of nitric oxide, and then we get this very predictable NO release. We wash it out, and I had this crazy idea. I said, let's add these two together and see what happens. And when we add these two together, we could quantify the synergism of these two herbs by their ability to produce nitric oxide. So these two herbs are always used in combination in traditional Chinese medicine. Nobody knew why. They've just done this for thousands of years. Yeah. Yeah, so these are the ones. So those two that were the kind of the synergistic was Danshin and Bingping. These two here, SBP and Danshin. So we could quantify the amount of nitric oxide being produced. And I thought maybe it's an artifact. We wash it out, we do it again, and we get the exact same profile. So now we had a way to dial in any level of nitric oxide we wanted based on how we combine these extracts. And then the next question was, what about diet? How do we explain the dietary effects on nitric oxide? And so again, we go back to the basics. The air we breathe is 78% nitrogen. That nitrogen is fixed primarily by lightning fixation, or they're nitrifying bacteria that fix nitrogen in the soil. So any vegetable or plant that we eat that's grown in the soil, or any animal proteins that we eat that have eaten the grass or the vegetables, then we're getting a source of these nitrogen oxides. So this is called nitrification. The human body actually is a denitrifying system. So when we eat, for instance, spinach or green leafy vegetables, 90 minutes after we consume this, the nitrate that's found in these vegetables is taken up in the duodenum, the proximal gut, and then concentrated in our salivary glands. So now after a meal, for the next 6, 8, 10 hours, we're secreting nitrate in the saliva. There are bacteria that live on the crypts of the tongue that reduce nitrate to nitrite, and humans don't have this enzyme, so we're 100% dependent upon the oral bacteria. And then when we swallow our own saliva, we get a burst of nitric oxide gas in the stomach. So again, go back and think about, we produce nitric oxide in a single biological compartment that has systemic effects. So as long as we're getting enough nitrate, as long as we have the right oral bacteria, and as long as we have stomach acid production, we're continuously producing nitric oxide and protecting all organs internally. So then we had to quantify this. So how much nitrate do we need to eat to see an effect on nitric oxide? So if we looked at the literature, you needed 300 to 400 milligrams of nitrate in a single meal. We took the standard American diet or the SAD diet, and here in the US, we're only getting about 150 milligrams per day. And that's over 2 to 3 meals. So just like most Americans are deficient in things like magnesium and selenium and chromium, we become nitrate deficient. Next, we took known dietary patterns and tried to quantify the amount of nitrate in these patterns. So this is the threshold you would need to lower blood pressure. The Japanese diet far exceeds this, and the dietary approaches to stop hypertension exceeds this. So this diet works because of its nitric oxide potential, the DASH diet. And all these other dietary patterns fall well below this threshold. Next question was, if we wanted to make dietary recommendations to patients and go, if you go eat 5 stalks of celery or 3 pieces of broccoli, would that be enough to normalize your blood pressure? And to do this, we went to 5 cities across the U.S. We went to Chicago, Dallas, Los Angeles, New York, and Raleigh. And we just took vegetables off the shelf, brought it back to the lab, and we analyzed it. And there's a lot of numbers on here. This is a table from the paper we published in 2015. Let's just take celery, for example. If you lived in Los Angeles or Dallas, you could go to the store, buy 5 stalks of celery, eat that, make enough nitric oxide to normalize your blood pressure. If you lived in New York, you'd have to eat about 60 or 70 stalks of celery. So there's 60. So there's regional differences in the amount of nitrate in these vegetables. So across vegetable categories and across different regions. These are conventionally grown vegetables, meaning that fertilizer's been added to it. We compare this to organically grown vegetables. Organic has about 10 times less nitrate than conventionally grown. So you can't eat enough organic vegetables to get enough nitrate to lower your blood pressure. And you think about this, to get an organic label, you can't add herbicides or pesticides, but there's restrictions on nitrogen-based fertilizers. Without nitrogen in the soil, you can't assimilate nutrients, including organic nitrate. So we have to have a balance now of eating nutrient-rich foods, but without the herbicides or pesticides. And that's the challenge. So I tell people, buy local and make sure you know what you're eating. Buy local, the local farmers. And here's the other problem. So we may or may not be getting enough nitrate in our diet. The other problem is 200 million Americans wake up every morning and use mouthwash. And there's 200 million Americans that have an unsafe elevation in blood pressure. I'm going to show you that this is not coincidental. This is causal. There's 200 million prescriptions written for antacids every year, and then 200 million prescriptions written for antibiotics every year. So to me, it's no wonder why Americans are the sickest population on the earth, because everything we do is shutting down nitric oxide production. And here's the data. We take normal intensive patients, we just give them mouthwash twice a day for 7 days, their blood pressure goes up. So we eradicate oral bacteria and cause an increase in systemic blood pressure. That increase in blood pressure correlates with a decreased production of nitric oxide. And this started to make sense to us back in 2002 when the oral microbiome, or the microbiome project was completed. So the bacteria that live in and on our body provide 3 million gene products. The human genome is only 23,000 genes. The bacteria that live in and on our body outnumber on human cells 10 to 1. So these bacteria are doing things that humans aren't yet evolved to do or can't do. So we tried to figure out which bacteria may be controlling blood pressure. So we took tongue scrapings of people walking around the Texas Medical Center, and then we measured their blood pressure. These are patients, faculty, staff, students. And what we found was we tried to see, could we culture some of these nitric oxide producing or nitrate reducing bacteria? And what we found was there's not a lot of healthy people walking around the Texas Medical Center, and they got a bunch of crap growing in their mouth. But here was the paper we published in 2014. The people who had the best blood pressure had the greatest diversity in the oral microbiome. The people who had the least diverse oral microbiome had the highest blood pressure. So this is an association, it's not causation. So we went back and we modified the study. Now we only took young, healthy individuals that had normal blood pressure. And these were mainly dental students, dental hygienic students who had obsessive compulsive oral hygiene practices. And so we took daily blood pressure readings. We gave them mouthwash twice a day for 7 days. After 7 days, we stopped the mouthwash and then brought them back 4 days later. And this is what happened. We took a 21-year-old dental student, and 7 days after blood pressure made him clinically hypertensive. His blood pressure went up 26 millimeters of mercury. So in 1 week, we took his blood pressure from, I think it was 120 over 80 to 146 over 95. We didn't change his diet, his exercise regimen. The only thing we did was kill his oral bacteria. Interestingly, 4 days after, his blood pressure completely normalized. 4 days after we stopped the mouthwash, his blood pressure normalized. We picked up the bacteria that disappeared when his blood pressure went up, and we picked up the bacteria that reappeared at the time his blood pressure normalized. Now, this is causation, and we sequenced the bacteria. They were expressing these nitric oxide producing genes. We could predict steady state blood pressure in all of these patients by the presence and number of these 4 bacteria. And now this explains things like resistant hypertension. So if you have high blood pressure, you go to your doctor, he puts you on a prescription medication, but yet 50% of the people that are on medication don't respond with better blood pressure. And the reason for that is we're finding that hypertension is a symptom of oral dysbiosis. So ACE inhibitors, ARBs, calcium channel antagonists aren't going to normalize your blood pressure. We have to get people off mouthwash. allow the oral microbiome to repopulate, create some diversity, and generate nitric oxide gas. So at that point, I felt confident that we had all the information we needed to start developing nitric oxide-based therapies. And so this was our highlights here. We wanted, if your body can't make nitric oxide, then we got to do it for you. But we understood the enzymology and the biochemistry to the extent that we could recouple the NOS enzyme and actually improve your body's ability to make nitric oxide on its own. And I'll take you through these clinical trials. So this orally disintegrating tablet, you put it in your mouth, it takes about 5 to 6 minutes to completely dissolve. But as it's dissolving, we're generating nitric oxide gas. You can see here, we can quantify it, and we can detect the nitric oxide coming out of the cavity. So just like we overexpress nitric oxide production in the heart, led to protection from a heart attack, we generate nitric oxide in the oral cavity, we can protect all organs systemically. It's vasoactive, meaning that if you give the lozenge, within 20 minutes, you see a statistically significant reduction in blood pressure in patients with high blood pressure. 60 minutes later, you see a further reduction in blood pressure. Now, this is 60 minutes, so the nitric oxide is completely gone in the oral cavity. So we're continuously generating in the body. And then 4 hours later, we see a 15% improvement in the body's ability to make nitric oxide on its own. So now we've actually achieved what we set out to achieve. If your body can't make it, we do it for you, but we fix the reason your body can't make it. If we look at an ultrasound of the left common carotid, so the carotid is your blood vessel that goes up your neck, we get a baseline picture here. 10 minutes after we give the lozenge, the carotid artery is dilated 13%. Using simple laws of hemodynamics, that's a 34% increase in blood flow to the brain. If you're having memory problems, you increase blood flow to the brain, you overcome cognition or mild cognitive disorders. In this particular study, we took patients with carotid intima media thickness, so subclinical plaque in their carotids. These are patients with cardiovascular disease. We give them the lozenge twice a day for 6 months. We lead to 11% plaque regression. So now we're reversing existing plaque in the lining of the blood vessel. And then this little guy here was a 5-year-old kid we started treating at Texas Children's Hospital, but he was born with an inborn air metabolism. And without getting too technical, these kids are, it's called arginosuccinic acid urea. So these particular patients are born without this enzyme called arginosuccinate lyase. It's part of the urea cycle that's found in, partial urea cycle that's found in every cell in the body. And their main problem is they can't excrete urea or ammonia. So they develop hyperammonemia. But these physicians were puzzled because their clinical symptoms couldn't be explained by their underlying genetic disorder. Because they have liver disease, these kids will have to get liver transplants at 7 or 8 years of age or they'll die of liver failure. They have blood clotting disorders. They have resistant hypertension. They have kidney disease. They have pulmonary disorders. So these kids have systemic disease. So we went to the lab and we modeled this in mice. We created an ASL knockout mouse that basically recapitulated human disease. And we published this in Nature Medicine in 2011. But this ASL enzyme or protein is what tethers the eNOS enzyme to the membrane. So in these patients who don't have this protein or enzyme, this complex falls apart and they cannot make nitric oxide. So now that explained clinically every single one of these symptoms. It explained the blood clotting disorders, it explained the hypertension, the kidney disease. So we started making a lozenge for this kid, and here's his lifelong blood pressure profile. You can see at 5 years of age, he had hypertension. He was put on 3 different types of medication to treat his hypertension. And his blood pressure, so he came to Texas Children's Hospital in February of 2010. He was in the pediatric intensive care unit with a blood pressure of 210 over 115. A 15-year-old kid that was about to have a stroke. Nothing would lower his blood pressure. We had evidence that it was a nitric oxide issue, so they started dosing him with isosorbide, dinitrate, which is an organic nitrate that's metabolized into nitric oxide. And you can see 4 days later, they released him from the hospital, and his blood pressure was pretty well managed for about a year. But February 2011, he came back to Texas Children's. We saw him. He was non-responsive to nitrate therapy because he'd developed what's called tachyphylaxis or tolerance. So we saw him at Texas Children's Hospital. His blood pressure was 185 over 110, taking 20 milligrams isosorbide 4 times a day. We dosed him with our lozenge, and within 4 hours, his blood pressure completely normalized. We got him off all prescription medication. We followed him for 12 months, and we published this in the American Journal of Human Genetics in 2012. But this was on headline news, world news. We saved this kid's life when basically no other therapy was going to save him. And his kidney disease resolved within 5 days. His heart disease, so at 15, he had a heart twice the size of a normal 15-year-old. Within 5 months, we completely resolved his heart disease. 5 months later, his heart was completely normal size, normal function. And we picked up a number of circulating endothelial progenitor cells. So we started mobilizing his own stem cells. They go to the heart and completely remodeled the heart and repaired him. So even in a patient with an underlying genetic disorder, the nitric oxide lozenge completely rescued this patient from all of his clinical symptoms. And you don't have to be that good at lowering blood pressure, because a simple 5 millimeter reduction in blood pressure reduces the risk of stroke by 1/3 and ischemic heart disease by 1/5. Now I'm going to take you through kind of how we've integrated all this into clinical practice. This guy here is my dad from, he had a car accident in 1984. So Dad turned 75 this year. So he's been rolling around in a wheelchair for 40 years. And he used to evacuate through digital stimulation. So we had hemorrhoids, and we took him to a general surgeon. They did a hemorrhoidectomy surgery, and the surgeon told him, go sit on a heating pad twice a day for 30 minutes to facilitate healing. When you take a paraplegic diabetic and you put him on a heating pad, you cook him. Obviously, he didn't know this was happening because of his paraplegia. So this is full thickness, 3rd-degree burns, obviously a very serious wound, risk of infection. So we took him to the hospital. The surgeon said he probably wouldn't survive this, but if he did, it'd probably take 6 to 9 months for this to completely heal. So at night, when the doctors and nurses left, I would create a nitric oxide releasing bandage and put over this. This is immediately after the skin graft. And what the surgeon said would take 9 months to heal, this was 3 months later. So we got complete new tissue growth. We completely healed this wound in 3 months, when they said it probably couldn't heal, or if it did heal, it would take 9 months. But Dad's been dealing with decubitus pressure ulcers for most of his life since he was injured. And when they graft over the burn, he had a decubitus ulcer forming. So this is under his right ischium. So this is a right ischial ulcer underneath his right butt cheek. So I could put a tennis ball in here. You probably can't see the diameter of this, but this is a pretty gnarly wound, severe infection, osteonecrosis, osteomyelitis. Took him to the best wound care docs. They said, you'll never heal this wound. He's an old man, paraplegic, diabetic. So I started generating a topical nitric oxide, and I would put it inside this wound. We killed the infection. We got tissue granulation. And this is today, 7 years later. So I tell people his ass still looks like a crime scene, but we completely healed this wound that everybody told us that we would never heal. And we did this through nitric oxide, but we used a number of different modalities. That had a number of oral infections. We got restorative dentistry. I did ozone insufflation. I insufflated the wound with ozone gas. I used light therapy, infrared sauna, topical nitric oxide. And then once we grew enough tissue, we did a surgical flap to completely close the wound. So that was really impressive, and all the surgeons and the doctors were like, how do you make this nitric oxide? And at that time, we didn't have a commercial product. So then I developed a dual chamber nitric oxide topical, and we launched this in 2019 in the skincare and beauty. And now we're taking this through FDA specifically for diabetic ulcers. So now we have a way to generate nitric oxide topically. I got a dual chamber nitric oxide serum. You take one pump from one side, one pump from the other. When you mix it together, it generates nitric oxide gas. And it'll diffuse into the skin. So I'm going to take you quickly through some of our clinical trials. This is using the serum twice a day for 30 days. You can see these age spots completely disappear. Inflammation on the skin is pretty much resolved. This is a 56-year-old lady who had, we call her the turkey neck lady. You can see here a lot of inflammation, wrinkles. 30 days later, the tone, texture, clarity of the skin improves. Inflammation goes away. Broken blood vessels, the varicosity here, almost completely resolved in 30 days. Again, the tone, texture, and clarity improves. This lady here just went and had a facelift, and before the skin reattached, she started smoking and applying pressure here on her chin and developed a full thickness ulcer. So rather than going through and basically suturing this and creating a scar, we just added the serum to this twice a day for 10 days and completely healed the wound. No surgery. And this is a young lady who had polycystic acne, unresolved for the previous 5 or 6 years. She dealt with this. We used the serum twice a day for 30 days. Polycystic acne is completely gone. It kills the bacteria in the pustules, eliminates the inflammation, restores blood flow. And this is the lady here had a 15-year-old scar from teenage acne. And so we just applied the serum twice a day for 30 days and almost completely resolve a 15-year-old scar. So we see, and we do biopsies, we can see improvement in collagen deposition, improvement in hydration, and the skin just basically, you slough off the old cells and build new cells. I want to spend just a little bit of time on COVID. The media is convincing us it's making a comeback. But let me just apply some very simple principles here because we shouldn't fear COVID or any other respiratory virus. So nitric oxide is how the immune system works to prevent any viral infection. So whether it's COVID or RSV or influenza, there's certain receptors in the epithelial cells. So these viruses like to bind to these receptors, they internalize it, they replicate, propagate throughout the body. But if our immune system recognizes this, it mobilizes an immune response, produces nitric oxide, and prevents the virus from replicating. So early in May of 2020, we realized that there were a lot of people getting sick and dying from COVID. And the people that were getting sick and dying from COVID were the people who couldn't make nitric oxide, the elderly, African Americans with a prior heart attack, diabetics. And this was the vascular inflammation we were seeing from the spike protein. Spike protein would bind to the ACE receptors and basically turn it into Velcro. Everything sticks. You get platelet aggregation. You get an elevation in D-dimers, microclots. So everything we learned about COVID disease could be inhibited by nitric oxide. So we developed a nitric oxide drug. We had it in phase 3 clinical trials throughout COVID. And there was evidence back from 2005 that nitric oxide inhibits the replication. This was SARS-CoV-1. Obviously, coronavirus was SARS-CoV-2, but mechanistically, it's the exact same thing. So we had an FDA-approved clinical trial. We sent patients home with a pulse oximeter so they could measure their blood oxygen saturation. And this patient here should have been in the hospital. His blood oxygen saturation was 79. We get a text, so we monitor these through telemedicine. We get a text on our phone that, hey, we've got a critical patient here. So we text this patient, go, hey, have you taken your study medication? And he hadn't. He took his study medication. This is a double-blind, placebo-controlled study. 8 minutes later, we improved his blood oxygen saturation to 91. So obviously, this patient wasn't on placebo. So here's what we learned from the COVID drug study. We treated over 650 very sick patients. These were African-American only patients, 50 to 85 on multiple medications. Not a single adverse event reported, not even a headache. We improved blood oxygen saturation by 14%. And more importantly, there was no treatment safety signal. So now that allows us, the FDA, to go straight into phase 3 clinical trials for our oral formulation. Most drugs never make it out of phase 1 because of safety. So we've demonstrated safety in a very vulnerable, susceptible patient population. Now we're taking our drug, our topical drug, through FDA clinical trials. And this is a smear here of Pseudomonas aeruginosa, which is a typical bug that's infected in most infected diabetic wounds. You can see here we just apply the nitric oxide drug here, and you get complete kill. I mean, this is like the original penicillin experiments, right? Here's some of our drug studies. We got a non-healing diabetic foot ulcer here. It was non-healing. We healed it in 30 days. This is a second-degree burn. We had the serum just for 7 days, complete healing, no scar formation. This is a patient similar to my dad, a 64-year-old paraplegic that was non-healing wound for 4 years, treated at Yale Medical Center up in Connecticut. So we started using the serum, the nitric oxide topical, and we completely healed this wound in 195 days, when for the previous 4 years at the best medical center in the world was unhealing. So what does this mean going forward? We can go straight into phase 3 clinical trials. We've got clinical trials for ischemic heart disease, ischemic non-obstructive coronary artery disease. We've actually got an Alzheimer's drug study moving into clinical trials now. This is our nitric oxide drug pipeline. Nitrovir is our COVID drug. We kind of put this on the shelf, but it will work for any respiratory virus. So whatever the next COVID variant is, we'll probably resurrect this drug study and get it as an early treatment. The other issue with the FDA was when we were trying to develop an early treatment regimen for COVID, they weren't interested in early treatments. They were interested in vaccine mandates. And so our drug really never had a chance from a regulatory standpoint. But this works because I'm probably the best example. We had 26 clinical sites all around the U.S. Since May of 2020, I've been on a plane every week, was in these COVID clinics. I didn't get the jab, and I don't wear a mask, and I've never had COVID. So it's just to show you that if you can produce nitric oxide, your body deals with these infectious agents. So here's our timeline. We've got an IND submitted for ischemic heart disease probably in the next 30 days. ischemic non-obstructive coronary artery disease probably in Q4. And then our Alzheimer's drug study will probably get that submitted to the FDA by the end of the year. So the one thing we had to do with the FDA was convince them that our drug was safe and that what we were doing was what nature intended. And so to answer this, we thought, how do we get the answer? So this guy here is Lincoln. He's now my 15-year-old son, but this was when he was about a year old. But when he was born, obviously we were discharged from the hospital. The discharge nurse told my wife, well, breastfeed, but if you can't breastfeed, then give the baby this formula milk. So we were obviously well aware of the health disparities between formula-fed and breastfed babies. So we knew we were going to breastfeed. But when we left the hospital, I kidnapped my wife and took her to my lab, and I got some of her breast milk. And I analyzed it, and I compared it to what was in the formula. And we published this in 2011. But the breast milk, the early colostrum, is enriched in nitrite. And then once it goes, so then we got an IRB, and I collected breast milk from 48 mothers at Memorial Hermann in the labor and delivery ward. And for those of you who don't know, with early kind of postpartum day 1 to 3, it's called colostrum. And then this milk transitions from the first couple of weeks, then from day 14 on, it's considered mature milk. But the concentration of these anions completely changed, where it's nitrite in the colostrum. And then when we tried to rationalize this, well, babies are born sterile, right? They don't have a microbiome. So they can't utilize nitrate to make nitric oxide. So the body actually provides nitrite in the colostrum until the baby becomes colonized with the bacteria, and then it switches and provides nitrate so the baby can make it on its own. But now we know that this is different in vaginal delivered babies versus cesarean. We've also been able to rescue necrotizing enterocolitis, 20% infant mortality, just by giving nitrite or nitric oxide in the breast milk or in the formula of these babies with necrotizing enterocolitis. The other answer came in studying people that live in Tibet. So we went to Tibet. These people live at 12,000 feet above sea level. Now, these are the people who lead the expeditions up to the summit of Mount Everest. These people walk around, they're not hypoxic, and we go to 12,000 feet, you get acute mountain sickness, many people get high altitude pulmonary edema, and they die. So what is it about these Tibetans that allow them to breathe in less oxygen because the partial pressure of oxygen is much lower at altitude? And we published this in Proceedings of the National Academy of Science in 2007. Even though these people are breathing in less oxygen per breath, they deliver more oxygen per unit time. So they become very efficient at delivering oxygen. And to explain this, we took the blood of these Tibetans. They have about 100 times more nitric oxide produced in the lining of the blood vessel than we do at sea level. This is nitric oxide bound to hemoglobin, 50 to 100 times higher concentrations of nitrate and nitrite in there. We've replicated this in Ethiopia, which is about 6,000 feet above sea level. And they have intermediate levels. So this is why people train at altitude. So it's not just erythropoietin, it's an improvement in nitric oxide. So athletes go to altitude, they train for 2-3 weeks, and now they become Tibetan-like. Now their body becomes super nitric oxide producers. And when they come back down to sea level, they basically can outcompete the competition. So this told us, and we presented all this data to the FDA, that we're basically recapitulating normal physiological response. If you're low in nitric oxide, we can replete it through this technology, and it's safe because we're basically intermediate. What we deliver through this drug and through the technology basically creates like a Tibetan-like person. We actually did this in the Afghan war because I was working with the Trump administration and SEAL Team 6. These people are up in the mountains of Afghanistan. They get on a helicopter, go to 12,000 feet, have to rappel down and be combat ready. But yet they get altitude sickness, even though they're well-trained and good athletes. So we would give them our lozenge. When they go up to 12,000 feet, they're fully acclimated, they rappel down, now they're combat ready. So let me just wrap up here and then we'll take questions. But the simplest thing to do to restore nitric oxide is stop doing the things that disrupt it and start doing the things that promote it. So what does that mean? If you use mouthwash, you have to stop. I mean, the data are very clear. There's a reason we don't take an antibiotic every day for the rest of our lives, because we know it disrupts the microbiome, causes systemic disease. You cannot destroy the oral microbiome every day. The consequences are severe. Elevation in blood pressure, you lose the protective benefits of exercise, causes erectile dysfunction. So you trying to make your breath smell good will lead to erectile dysfunction. The other issue is fluoride. Fluoride is an antiseptic. It's a neurotoxin, and it kills your thyroid function. If you're using a fluorinated toothpaste, you have to stop. It's killing. It's a major problem. Antacids. People who have been on PPIs for 3 to 5 years have a 30% higher incidence of heart attack and stroke. A study out a couple of weeks ago, people who have been on PPIs for 4 years have a 40% greater incidence of Alzheimer's and vascular proton pump inhibitors. Proton pump inhibitors, it's a class of antacids, things like omeprazole, Prevacid, Prilosec. And then just change your diet. A balanced diet in moderation, stop a lot of eating complex or simple carbohydrates. Once you do that, now your body's primed to make nitric oxide. Now you can do the things to restore it. Throw in some more green leafy vegetables, moderate physical exercise. I like light therapy, red light. I have an infrared sauna. I sit in at home. And then if all else fails and you don't want to do that, then we have product technology that does it for you. I like this slide because when everybody looks at their phone and they see this low charge, what do? You go plug it and recharge it, right? Well, our body tells us we get a red light signal too. It's telling us that we're sick. These are symptoms. So we have to pay attention to this red light on the human body. What is this? It's ED, it's hypertension, it's diabetes. So it's telling us we need to charge. We need nitric oxide. So do these things, stop smoking, stop using antacids, and then restore nitric oxide production. And I show you this complex biochemical slide. This is the biochemistry that I elucidated back in 2004. And I show you this because if you're taking a nitric oxide product from a company that doesn't know what they're doing, you can actually have a lot of unintended consequences here. Form nitrosamines, this nitrosative stress here. And so we have to dictate and specify the metabolic fate of nitric oxide. That's what we do. All these other companies really pretend that they know what they're doing, and they can cause more harm than good. And I think this sums it up. The greatest enemy of knowledge is not ignorance, it's the illusion of knowledge. We've lived through 3 years of illusion of knowledge, and it's been very dangerous. So ignorance is curable. It's just knowledge and information. So let me just conclude here that hopefully I've convinced you nitric oxide controls and regulates blood flow and oxygen delivery to every cell in the body. There's an age-related decline that asserts its effect on cardiovascular risk. Diet and exercise are not always sufficient, especially if you're using mouthwash or proton pump inhibitors. We know through our drug discovery program that this will have a profound impact on public health. I predict this will be the way we treat patients for the next 100 years. Because there's not a single clinical indication where nitric oxide at the right dose, at the right time, in the right patient wouldn't be beneficial. And that's diabetes. Yeah, you missed that part. And so we must use safe and effective nitric oxide product, and your body cannot and will not heal without it. So there, I'll leave you a couple of references. This is my latest book. I got a new book coming out in January called The Secret of Nitric Oxide, Bringing Nitric Oxide to Life. This is a lay read. This is a medical textbook I edited with Joe Lascalza, who's chair of medicine at Harvard Medical School and chief of cardiology at the Brigham. There's a website here. It's an educational website. We got a 6-minute video on there to provide your patients or consumers with education on nitric oxide. You can follow me on social media, and if you've got questions that come up after this, just please email me. I'll always respond. Sometimes it may take me a couple of days, but I'll always get back to you. Yeah. So with that, thank you very much for your attention.
Dr. Nathan,
the question here is, does nitric oxide regenerates the pancreas, or what does it do?
So it mobilizes resident stem cells. The job of stem cells is to go to any dysfunctional cell or tissue and replace or regenerate. So we can mobilize them from bone marrow. We can do it from adipose-derived stem cells. I mean, everything's different, and it depends upon the underlying etiology of that particular patient. If they're full of toxins, they have poor blood flow, then it's probably going to take a little bit longer. If you've got a healthy patient, we can just... The lozenge, typically we find the best clinical effects, 1 lozenge twice a day. That kid that I showed, he was taking 1 every 4 hours. Every 4 hours to manage his blood pressure. That's right. Yeah, we got this. We got the serum. We got the lozenges. Nitric oxide. Try it. I love it. And full of energy.
Yes. Uh-huh. Yeah.
Well, I'm 77 in 5 months, so I'm a little
Wow.
older than I appear. I need a double dose, yeah. 3.5 years from 80 years old, yeah, I need a double dose.
Yes.
I've been a vegetarian for 50 years. That has helped somewhat. Plus,
Yeah.
I don't do all the mouthwashes and all that
Good for you.
business. I learned years ago that not the way to go. Well, okay. I think that was all a comment.
Yep.
A comment from me, just quickly.
I don't use mouthwash. I brush my teeth twice a day, and I use a fluoride-free toothpaste, but I don't use a mouth rinse.
Mm-hmm.
But we're in the process of developing a mouth rinse, so stay tuned.
Are you getting any trouble from the organized medical cartels and the pharmaceutical cartels? That's, of course, and unfortunately, it's all entangled, troublingly so. And that's why David is having these med expos to expose the problems, issues that we have. Very complex, very troubling.
Well, this is very disruptive, and obviously disruptive technology becomes a target. Because now for the first time in the history of Western medicine, we can talk about weaning patients off of drugs. And that's disruptive to the bottom line.
Disruptive to the bottom line, which is the economic system, as you know.
That's right, yeah.
Well, I'll just simply share the final statement with all of you here, and that is that we have a long way to go, but I think that we can heal the social, political, and economic and existential systems. Anyway, outstanding work. Thank you so much. Outstanding.
Thank you.
Thank you.
Okay. Yes. So the question is the nitric oxide test strips. I developed those test strips back in 2010. So it's a saliva test strip that turns pink. What we're measuring is salivary nitrite. So the ability of the presence of nitrate-reducing bacteria. I've gotten away from those test strips because there's too many false positives. There's no such thing as a false negative. If you're low, you're low. The false positive issue comes in if you've got an active oral infection. So it's an acute immune response in the oral cavity, and it's not reflective of systemic NO production. So for that reason, we've gotten away from using the test strips. They're a good tool to have in your toolbox, but they shouldn't be the only thing you're using. And the biochemical kind of symptomology is really what dictates the need and necessity. We do. We're what's the booth number? 14.
Let's go to your booth and we want product.